Good evening, everyone. Thank you very much for taking the time to come and join us tonight for this Pharmacy Insight event. I am Dr. Aaron Courtney, and I am the course director for the MPharm program. This is the course that you have to do if you want to become a registered pharmacist here in the UK. This evening, we're joined by a host of staff members from the School of Pharmacy itself and Pharmaceutical Sciences, and also from the admissions team. So myself as course director, I also have Miss Avril Fox, who is our school officer. We're also joined by Dr. Larry, our associate head of school, and I also have on the team here Dr. Heather Coleman, who is our academic admissions tutor, who sits within the School of Pharmacy itself. The plan for this evening is we are going to take you through some of the core elements relating to the interactive component as part of the admissions process to join the School of Pharmacy and specifically the MPharm course. Before we get into that, I think it's important that we explain where pharmacy is held. We have the MPharm program is currently housed in the Coleraine campus along the north coast of Northern Ireland. For any of you who have been here, you will know that this is a very idyllic part of the world, fantastic scenery, great beaches and fantastic opportunities for sporting activities. We have a brilliant campus, and we would be delighted to welcome you on campus if you have the opportunity to come. And we will have sessions in the new year, open days for you to join. We would highly encourage you to do that. In terms of specifically why the MPharm program, we are proud to say that we have performed very well over this past number of years in some of the national league tables. That's the UK, including Northern Ireland. And you can see there, we're delighted to say that we are second in pharmacy and pharmacology in the Guardian University Guide for this year. We're third in pharmacology and pharmacy for the Times Good University Guide, fifth in the Complete University Guide. And importantly, we have a 96% positivity rating in the National Student Survey, which is directly from our graduates who have said that they've obviously had a fantastic experience joining with our school specifically. You can see here a quote from one of our past graduates, Louise Toner, who came through Ulster University and did the pharmacy program, is now working as a registered pharmacist. And you can see that she states the single best decision I made as a 17-year-old was to select pharmacy at Ulster University on my UCAS application. And we are delighted to have such positive comments from our past graduates and current students. So if you do get the opportunity, we encourage you to speak to past graduates. We encourage you to speak to students who are currently studying. And of course, if you have any questions, you can reach out to the staff team for those little bits of detail. In terms of what we're planning to cover this evening, hopefully this will be a relatively short session, and we're encouraging everyone to put their questions into the chat box. So if you do have any questions, my colleagues are currently reviewing those and will hopefully be responding. And if there's anything that they want me to comment on, I'm happy to take comments and go through questions towards the end. This evening, we're going to be talking specifically about where to find the admissions information. There's a huge amount of information, and it very much depends where you're applying from, what stage in your journey you're at. And so we will be signposting you to the most appropriate places to get all of that information. But of course, if you have any questions, we're here to help. So we're happy to answer those. We're going to talk a little bit about the changing role of the pharmacist. We're going to give you an indicative timeline of the application process, what to expect. But really the focus of tonight's discussion is to look at the interactive component. What is that? How will it work? What could I be asked? What is expected of me as an applicant? And what are we doing from a university point of view in terms of supporting you through that process? At the end, we will have a sort of formal opportunity for questions. But as I said, I would encourage you to put your questions into the chat box throughout the session, and hopefully the staff there will be responding to those as best they can. So in terms of where is best to go and get the information, all of our admissions information is housed on our online prospectus for the MPharm course. So just to reiterate that, if you want to become a registered pharmacist here in the UK, you have to complete the MPharm course, which is an accredited course by both the PSNI, the Pharmaceutical Society of Northern Ireland, and the GPHC, the General Pharmaceutical Council of Great Britain. So the university, Ulster University, has gone through accreditation for a number of years. We're re-accredited this year with full approval to deliver the MPharm program. So we're delighted to say that we have ongoing commitments to the pharmacy program within the university and within the School of Pharmacy and Pharmaceutical Sciences. If you are searching online, our UCAS code B230 and the university code is U20. Specifically, the link that is on screen, and I'll maybe ask one of my colleagues if they can copy and paste that into the chat box for everyone. That will take you directly to the online prospectus where you can see all of the information about admissions and all of the various different routes that are available to you. Ulster University is an access-focused university, and so there are many different ways that students can access this course. If you have some non-standard qualifications, something that you're not quite sure of, please do reach out to the admissions team. They will be able to advise you specifically on your own circumstances, and they may need more information if you have something specific to report. You can get in touch with us at the School of Pharmacy at pharmacy@ulster.ac.uk, and of course you can contact the admissions team directly as well, which is admissionsce@ulster.ac.uk as well. A bit of a disclaimer that we have to put up there. This is part of our accreditation process, is to say that our courses are continually reviewed, and of course we take advantage of new teaching approaches and developments in research, in industry and across the profession. So things may change as you go through the pharmacy course. That specifically relates to some of the modules that you may be seeing on our online prospectus at the moment. What we do is we put up there the current provision, but obviously as the profession updates and things change, you may find some differences to that. The exact module availability, their order may depend, varying on course updates, staff availability, timetabling and student demand. Specifically, that there is probably focusing on the elective modules that we currently offer, but we can give you specific information on the most up-to-date module list, and at the moment our online prospectus has that information. So what you're seeing is the most up-to-date information. One of the key things I want to comment on this evening is really why we have to have this interactive component as part of our admissions processes in the first instance, and I think that really reflects the changing role of the pharmacist. Pharmacists have moved from being really science-focused experts in medicines to a more enhanced clinical role focused on communication with patients and other healthcare professionals. We have a focus of industry practice on our course, alongside our three clinical sectors of community pharmacy, hospital pharmacy, and general practice pharmacy. And ultimately, following our accreditation with the General Pharmaceutical Council and the PSNI, Pharmaceutical Society of Northern Ireland, part of that process involves us making sure that we are adhering to our standards for pharmacy professionals, a document that was printed back in May 2017, and also more recently, the standards for the initial education and training of pharmacists in the interim learning outcomes that were published back in 2021 for all schools of pharmacy in the UK. And as part of those documents, we are required to run a short interactive session with pharmacy staff. Different universities have interpreted this in different ways, and we are going to talk you through this evening how we as a school have interpreted this and what we are asking our applicants to do. Students will be given a conditional offer, and it will be subject to conditions, including, for example, appropriate performance at the interactive component. In terms of an indicative timeline, what to expect in the incoming year, you can see that from November, offers may be made based on entry requirements and subject to successful completion of the interactive component, along with a number of other conditions that will be stated with the offer. That is for applications that are coming in through the UCAS system, which concludes this year on the 31st of January 2024. Additional information regarding the interactive components will then be sent out after the offers are made. So you apply to us through the UCAS process before that deadline of the 31st of January 2024. Our admissions team will process your application through UCAS and make sure all of the particulars are in order, and then they will write out to you with the offer and the information regarding when the interactive component will take place and how. We will be offering both in-person on-campus interactive components and also online sessions. We aim to have those interactive components on the 17th of February 2024, and that will be during our conversion event open day on the Coleraine campus on the 17th of February. For individuals who are not able to attend that in person, obviously we have applicants from across the globe, and we're not expecting everyone to fly to Northern Ireland for a 5 or 10-minute conversation. We will be holding online sessions for those who aren't able to attend on that day. Then on the 6th of June, this will be where offer holders are to make firm and insurance choices. I've been asked by the admissions team to make clear that anyone that's interested after the 31st of January, that closing date through UCAS, will need to submit their details and will be kept on waiting lists if places become available after all results are known later in the summer. So hopefully that's useful in terms of a timeline. So in terms of the interactive component, what is it and what to expect? We are very much viewing this as an opportunity for you, the applicants, to speak to Ulster University staff within the School of Pharmacy and Pharmaceutical Sciences. It will be a conversation that will last approximately 10 minutes, and we are quite strict on our timing. We will be offering face-to-face on campus, as I've said, and that's on the 17th of February at our conversion open events, and full details of that will be sent to applicants after or at the stage where they're given their conditional offer. We will also be running online sessions for students who are not able to attend, and that will be later in the semester. That will be later in 2024. What will be expected is students will undertake, or applicants, sorry, I should say, will be given a range of situational based judgment style questions. Okay. This will range from very basic and straightforward questions, who you are, why you want to attend the course, right through to more problem-solving based questions. We very much view this as an opportunity for students to ask us about the course and get to know some of the members of staff. It will be the academic staff predominantly who will be undertaking the questionnaires themselves. And so it would be an opportunity for you to speak to them. And if you have any specific questions, they're more than happy to answer any questions that you have for them. In terms of specifically what we're looking for, these situational judgment tests are supposed to identify or give applicants an opportunity to demonstrate key professional values that are outlined in the standards for pharmacy professionals, that document published back in May 2017. And you can see those listed on screen. They focus on person-centered care, problem solving and decision-making capacity, an individual's self-motivated learning, their effective communication, their professionalism and integrity, and their capacity for resilience and adaptability. So what to expect and how will that work? What we have done in the school, we have gone through a process of training year on year for our academic members of staff and for those involved in the interactive component itself. And staff will assess the candidate's performance based on what you say. Okay. So each scenario, each question will be scored, and it will be scored by the staff member who you're speaking to. It'll be a one-on-one. And candidates will then be ranked based on their total score. Okay. Staff will be prompted to highlight anything that would cause concern or anything that a student might say or do that might cause a concern. And really what we're thinking here is anything that staff might be concerned about in terms of if an applicant suggests to do something perhaps illegal or that might cause patient harm, for example. Those are key things that would obviously be flagged and raised and be reviewed by the staff team. And we have a senior oversight team looking after our interactive component. That's headed up by our Associate Head of School, Dr. Lowry, and also our academic admissions tutor, who is Dr. Coleman. In any instance where individuals are flagged or there is a concern raised, we may reserve the right to hold a follow-up interview with that individual if that's needed. But again, that individual will be contacted separately after the event and given an opportunity to explain what they said or what they meant. So what could be asked, or maybe more importantly, what might not be asked, I think is also quite useful. In the interactive component, we are focusing on the way that the individual will communicate with us, the staff member. So you'll be asked a series of scenarios where you have to think about the information that you've been given, provide an answer to the problem that you've been given, but particularly thinking about communication and explaining your logic and your thinking behind the decisions that you're making. Some of our situational judgment tests, it's not that there is a specific right answer that we are looking for. On the contrary, there are potentially multiple options that a candidate might select. But ultimately, what we're looking for is an individual to be able to communicate your rationale for the answers that you're giving. We won't be assessing your specific knowledge of pharmacy or science in the interactive component. So you don't necessarily have to have an in-depth knowledge of specific drugs or mechanisms of action or anything like that. We're really looking at the capacity to demonstrate those professional behaviors that we discussed earlier: person-centered, problem-solving and decision-making, self-motivated learning, communication, professionalism and integrity, and capacity for resilience and adaptability in certain situations. We may be asking you to handle some basic numeracy as part of the process, but certainly a complex mathematical calculation you will not be presented with. Anything we ask will be fairly straightforward, but the key is in how you address the question, the dilemma that is put before you. What decisions would you make? Why would you make those decisions? And how you communicate those to us, the staff member who's undertaking the interactive component. In terms of the specifics, as I said, we're asking you to demonstrate your professional values and attributes that you would expect of a professional pharmacist. This really circles back to ensuring that those who get onto the MPharm program have the capacity to demonstrate these characteristics from an early stage. These characteristics you will see are integral to progressing through our pharmacy course. And so this is why, as part of the admissions process, we are ensuring that applicants coming onto the course are able to demonstrate these professional attributes even before they begin their journey with us on the course. We're not so much focused on your knowledge of pharmacy. That is something that we will certainly teach you and help you as you go through the course and through the MPharm program. Really, this is an opportunity for you to communicate to us why you're a good candidate to become a pharmacist. And that's really through those situational judgment-based style questions that we'll be asking. At the end of the interactive component, staff will offer you an opportunity to ask any questions about the course, about the campus, or about the university. And I know from running this over this last couple of years that prospective students really value this opportunity to speak to our staff. So it's a win-win for everyone. At this point, this is really the point where we're asking you if you need more information about what to expect and where you can go to get that information. So for example, you can go on to ulster.ac.uk and search for the MPharm Pharmacy program. You can email pharmacy@ulster.ac.uk and that will come to us here at the school. And if you have any questions regarding admissions, you can get in touch with our admissions team. That's at admissionsce@ulster.ac.uk, which is in the chat. And of course, you can look at our online prospectus should you have any further questions about that admissions process. We would encourage you to go to UCAS and apply. And we're delighted to say that we have a fantastic campus. We have a fantastic staff team, faculty, who support you as you go through your course. And the best people to speak to is to speak to students who have actually come through our course, who are now out working in the real world. They have come through the process and know what we offer and know how best to explain that to you. So folks, thank you very much indeed for listening. That takes me to the end of the formal presentation. But at this stage, I'm quite happy to answer any questions that are coming into the chat box. If you'd like to ask something, please put it into the chat box. I believe mics have been disabled at this point. So please put it into the chat box and we'll do our best to work through those now. So I see some questions in the chat box. Is there anything I have to do if I want to work in the Republic of Ireland after graduating with the MPharm degree? A good question. Once you come through the MPharm program, you will, with Ulster University in Northern Ireland, you will register as a foundation training year student with the Northern Ireland Centre for Pharmacy Learning and Development, and you will then ultimately register as a pharmacist with the PSNI, Pharmaceutical Society of Northern Ireland, or the GPHC, General Pharmaceutical Council of Great Britain. And that depends where you choose to do your 5th foundation training year, which is separate to the MPharm program, although we prepare you for it and we work hand in hand with the regulators and providers so that you have a seamless journey through the 5 years. To work in the Republic of Ireland, you do have to register with the Pharmaceutical Society of Ireland, and that requires that you approach both regulators and ask them for what's known of a letter of good standing. Okay. At that point, the current process allows you to transfer between one register to the other.